here. Welcome to Health and Wellness. I'm Will, nurse practitioner, and today we're going to be talking about STDs, or what's now called STIs, sexually transmitted infections. If you're watching this video, probably alone in your room without anybody around, it's very possible that you have some nasty stuff going on down below. Now, believe me when I tell you, it's actually a good thing that you're having these symptoms.
Wait a minute.
This way, you know you have it, and so you can get it treated. STIs are actually very common. The CDC estimates that approximately 20 million new infections each year occur, and many of them in the younger demographic. Most sexually transmitted infections are easily treated, but this doesn't mean you should blow it off. It's estimated that nearly 24,000 women experience infertility because of sexually transmitted infections that were never treated. Some sexually transmitted infections are irreversible, like HIV. So if you don't have symptoms, you're good then, right? Wrong. Many people who have common sexually transmitted infections never show any symptoms at all. This means that every person that they go on to have unprotected sex with will likely contract the infection as well and spread it onto their sexual partners. The main two STIs that I want to focus on are gonorrhea, also known as the clap, the drip, the morning drip, and chlamydia, also known as the clam, because these two are both very common and very easily treated. So how do you get a sexually transmitted infection? By being sexually active. And not only by being sexually active, by not taking protective measures beforehand. This includes protective measures such as condoms or dental dams, even though nobody's using those. By far the easiest way to avoid a sexually transmitted infection is through abstinence. Seeing as how most of you will not follow this advice, condoms is the next best step. You also want to be careful about who you're having sex with and if it's even a good idea. Oral sex is often overlooked when it comes to protection, but you can get sexually transmitted infections in the back of your throat. So what are the symptoms of STIs? Well, it really depends which sexually transmitted infection we're talking about. In regards to gonorrhea and chlamydia, women may often experience vaginal discharge or itching, abnormal bleeding or spotting, lower abdominal pain, painful sex, or burning and pain with urination. Certain sexually transmitted infections are associated with a specific type of odor, such as the characteristic fishy smell of trichomoniasis. Well, fishier. If men are having symptoms, it's usually pain with urination, burning, or penile discharge. Sometimes in men, the infection can travel from the urethra to the testicles, where it can cause epididymitis or orchitis, which are infections of those tissues. This is usually accompanied by severe pain, swelling, and usually fevers. Okay, so if you're still watching with me and you might have some of these symptoms, what do you do next? You call your doctor and you make an appointment. Now, I know these things can be a little bit embarrassing, but doctors, nurse practitioners, physician assistants deal with these kind of things all the time. You could also go to an urgent care or a Med Express, and you can even go to the emergency department if that's all that you have access to. However, I usually recommend against using the emergency department for non-emergent things if you can fit it in elsewhere. You can also find a local health clinic which sometimes does free or anonymous testing. Once you make an appointment, your provider will talk to you about the symptoms that you're having and your sexual history. Next, they'll probably take either urine samples or swabs of the discharge. If you're a female, they'll likely do a pelvic examination, which means they'll insert a speculum and obtain samples from around the cervix to send for testing. Okay, so you're having these symptoms, you go to the doctor, they think you have an STI. So how do you treat it? Treatment for sexually transmitted infections depends on which type of infection you're treating. If you have symptoms of chlamydia or gonorrhea, which often overlap, in terms of gonorrhea, you're usually treated with an antibiotic injection called ceftriaxone or Rocephin. Chlamydia is usually treated by a one-time large antibiotic dose of azithromycin. After 7 days, you are no longer considered infected. But you can get reinfected with the same infection. Just because you're treated once does not mean you're treated forever. If your provider diagnoses you with one of these infections, you really should reach out to your previous sexual partners within the last 60 days and let them know that you've tested positive and that they should go in and seek treatment. Again, if these infections are left untreated, they can lead to a more severe infection pelvic inflammatory disease, and infertility. But not all sexually transmitted infections are easily treated. Some, like HIV, herpes, and HPV, are irreversible, and once you're infected, you have it for life. So how often should you get tested for STIs? It really depends on your sexual behavior, but most sexually active individuals who are not in a monogamous relationship really should be getting tested yearly, and if they've had a previous diagnosis of a sexually transmitted infection, they might want to get tested more often, such as every 3 and 6 months. For more information about sexually transmitted infections, you can go to the CDC website linked below. I also have clinics down below which you can go get tested, some of them even for free or anonymously. If you have any more questions about sexually transmitted infections, please make an appointment with your doctor and ask them. That's all I have for today. Be sure to follow my blog at healthandwellness.org. You can also follow me on social media, on my Pinterest, Twitter, Instagram, Facebook, and that's about all I got. All right, catch you later, but don't catch it later, okay? If you just had sex and you didn't wear protection, better go to the health clinic and get tested. All right, I'm gonna wrap this up. No, but you better wrap it up. Oh, you know what I'm saying? No. All right, bye.